We usually think of healthcare as something you get from a provider, but care and prevention are also the work of local communities looking out for their needs. And that means a broader view of health, from access to food and exercise to help in the struggle with substance abuse. Helping to coordinate those efforts in the neighborhoods is the job of the Boston Alliance for Community Health. We'd like to welcome as our guest from the Alliance, the Community Organizing and Communications Manager, Jamiah Tappin. Thank you very much for being with us, Jamiah.
Thank you.
This is an organization that has support from a lot of providers in the area, but talk about how this came together.
So we are one of the community health network areas for the state of Massachusetts. And we came together because we really wanted to begin to focus more on some of the structural issues. For a very long time, we had been focused on sort of smaller community-based projects, such as a yoga class for seniors or healthy cooking classes for young people, but then we really want to think more broadly about the work that we do. So we sort of have been restructuring to focus more on social determinants of health and racial and ethnic health equity.
Well, talk about how your organization helps with that sort of those racial disparities, both in access to care and just the health of people in general.
So a few years ago, almost 4 years ago now, we embarked on a very extensive planning process called Mobilizing for Action Through Planning and Partnerships, or MAP as we like to call it for short. And this was a way for us to really engage a lot of residents, neighborhood coalitions, hospitals, health centers, community-based organizations, to really think about these racial disparities and how we can work to improve them more on a systems level, thinking within communities and across the city.
Well, I know one of the problems you also have that's related to this is access to healthy food, which is about money, but it's also about location and just knowing that it's out there.
Yeah, so one of the biggest problems that we have, and one of our initiatives is working on called Let's Get Healthy Boston, is how we can increase residents' access to healthy foods. It could be as simple as helping our local corner stores have more healthy foods up front, to doing more farmers markets and having more SNAP benefits at the local farmers markets.
Of course, you also have, I guess, efforts to create almost like a climate of health. In Mattapan, you have all these things going on with people on bikes. So I guess that's part of what you're also trying to get going here too.
So one of the things that we're working on, not just in Mattapan, but citywide, but Mattapan Food and Fitness Coalition actually has a really strong effort to work on active transit, so biking, safe routes to school. And I think that that's one of the most important things. I think the rise of Hubway has really gotten people more interested in biking, and one of the goals is to have Hubway more accessible in different neighborhoods, and to get more people involved and active.
Now, in other neighborhoods, you have things, even in Charlestown, you've got a group that's concerned with substance abuse too, right?
Yep, one of our key issues is around trauma. So we think about trauma, not just the substance abuse issues, dealing with overdoses, but also issues of community violence. So trauma is a really broad thing that we think about at BAC, as well as in a lot of organizations that do public health.
And trauma is something a lot of people sometimes don't think that they necessarily fit this, because it could be anything from violence in the street that you just happen to live near, or it could be something in the family that's terribly wrong. There are people being abused in the family.
Yeah, so trauma, we do tend to think of trauma as like an individual, something that happens on a micro level, that when an incident occurs, it impacts that family or that person, and really it impacts the entire community. And so when we have reoccurrences of instances of violence or overdoses, we really want to think about how that community is impacted and how we can become more resilient and sort of identify these groups in the community that are really good at uplifting and empowering the residents around them.
Of course, the other thing you want to do is let people in the community get involved in this. What can they do?
So we have two important things coming up. One is our annual meeting, which is on November 16th, which is a great way to learn about all the projects that we're working on and connect with the people that are leading them, from initiatives to the healthy food access, to active transit, to education opportunities, and also the work around our 5 strategic issues, which can be from talking about specific racial and ethnic disparities, as well as connecting clinical models of prevention to community-based models of prevention. So all of those things are happening throughout Boston, and connecting with us at the annual meeting is a really great way to start.
So if people would like some more information, what's the best way for them to find out?
The best way for them to find out is to either contact me directly or attend our community engagement and membership committee meetings, which happen monthly. The community engagement is a really great way to not just engage residents, but to network with other residents. We've been really trying to connect more directly with individuals in the community to provide them with educational opportunities, leadership pipelines, and addressing some of the issues that really matter to the individuals that are in the neighborhood. And we have monthly meetings, and it's a really great way to connect and learn more about the issues that BOC does and that we are partnering citywide.
Thank you very much for being with us. Jamiah Tappin from the Boston Alliance for Community Health.